These sciatic stretches are known to be the best stretches out there. All the years that I have seen sciatic type patients, low back, pinched nerve, herniated disc, bulging disc problems, these particular stretches I'm about to show you are known to be the best stretches, hopefully that will help your condition as well. Now, the sciatic nerve is a nerve that is the largest, fattest nerve in the body. This nerve runs from the lower back, down the buttocks, down the leg, all the way down to the toes. This is when you may complain of tingling, burning, aching, tiredness, cramping, anywhere down the back of that leg. And once it gets below the knee, you can feel it anywhere in the lower leg as well as the foot and toes. This stretch is called the Piriformis Stretch. This is where we are stretching the external rotators. These are the muscles where the sciatic nerve runs underneath. So when these muscles are contracted, very, very common. People who have low back pain and sciatica, even if you have herniated discs, many of these conditions are related to this particular area that we're going to stretch, called the piriformis. They are the external rotators of the hip joint. We're going to bring one knee up, and we're going to bring the leg behind the knee. And what we're going to do is we're going to take our hands behind the knee and we're going to pull it towards our chest. And as you pull it towards our chest, you're going to feel the pulling and the burning on the opposite buttocks. Okay? And you're going to hold that stretch about 20 seconds. Then you release it. Then you'll pull up again a little bit harder and you'll feel that burning on the left buttocks, but make sure that you're externally rotating the opposite leg. Okay, you'll feel it pull. You're going to do both sides. Okay, you're going to come behind the leg and you're going to pull it towards the chest, and you're going to feel this side burn, the external rotators. You're going to hold that stretch about 20 seconds or so, and you're going to do that stretch about 6 to 8 times on both sides. That will really release that muscle. Now, that piriformis stretch can be modified into a sitting position, but you need to make sure that your knees are about as equal as your hips. You're going to cross the leg, and what you're going to do is you're going to bring the chest to the foot. And as you bring the chest to the foot, keeping the back straight, you're going to feel the burning and the pull on the left side, and you're going to really feel that burn. But hold that position about 20 seconds or so, and you can do that stretch several times on both sides. Again, we cross the opposite side, keep the back straight, you're going to bring the chest to the ankle, and you're going to feel the opposite buttocks burn. You're going to hold that 20 seconds or so, and you can do that several sets as well. Okay, this next stretch, very simple. You're going to put your right leg over your left leg, and you're going to hug. This is called the seated hug stretch, where you can actually take the knee and pull it towards your body like this. And as you pull towards your body, you're stretching the whole lateral part of the pelvis, which is going to release a lot of those muscles that's irritating that sciatic nerve. You can cross it back the other side, and you're going to hug it, just hug it into your body, and you'll feel that nice stretch on the other side of the buttocks. You can actually hold that stretch 30 to 60 seconds on both sides, and that will really release those lateral muscles of the buttocks region. This next exercise is called the Pigeon Pose. What we're going to do is we're going to bend one leg out in front of us like this, with the knee facing forward. Try to keep that back leg straight as much as possible, and I want you just to breathe through it. As you sit down, you're going to feel that burning on the buttocks area, which is on the same thigh, leg, knee that's being bent. Okay? That's what you're trying to stretch, right in that piriformis area, right where that sciatic nerve comes out. And obviously what we'll do on the other side, we'll cross. Okay, bend it, keep that back leg straight. Okay, same thing, try to sit back, and you're going to feel that buttocks really burn on the opposite side there. You're going to go ahead and breeze through that. about 30 to 45 seconds on both sides, which will help make a big difference in help relieving that piriformis and external rotator muscles. This last exercise is called the self-trigger point therapy. Take a tennis ball, golf ball, or any big ball you have. If you don't have a ball, use your knuckles. You're going to lay back. You're going to go ahead and get to the point that's very tender. You're going to cross your leg, and you're going to put the ball right underneath that part of that muscle, and just lay on that area to where that muscle feels sore, and just apply your weight for about 60 seconds to 90 seconds, and let the weight of your body work that trigger point. And by releasing that trigger point, will release the contracture of that spasm and hopefully make a big difference within your pain and in your symptomatologies that you're chronically suffering from. So remember, sciatica can come from many different conditions. Knowing the root of your condition is extremely important. With these exercises that you can do at home, hopefully you will make a big difference in your healing and in your recovery as well as your pain. Make it a great day. I'm Dr. Alan Mandell.